You're watching KRQE News 13 at 5:30.
What's the best way to treat people with substance abuse problems here in New Mexico? It's a question lawmakers on both sides of the aisle want answered. So much so, a bipartisan bill to look at the rehab structure in our state is already working its way through committees. News 13's Natalie Wada spoke with one sponsor of this bill. She's in Santa Fe this evening with that story.
House Bill 34 would create a study of whether they could create a state-run long-term rehab center.
New Mexico has some of the highest incidences, for example, of alcohol abuse and some substance abuse. But we don't have enough facilities or caregivers either with respect to making sure that people can get the rehabilitation that they need.
So, Democratic Representative Pamela Herndon is asking the legislature for $400,000 to fund a study of the rehabilitation system in New Mexico. She wants to look at the feasibility of a state-run, long-term residential rehab facility and how to create a coordinated behavioral health care plan between cities, counties, and the state.
Because right now what happens is there is no coordinated plan. Individuals may go to the state for some help, they may be dismissed, but there may be additional help that can be obtained from a city or county facility. The goal is to have the state as the long-term provider, counties as a mid-level provider, and our cities as outpatient and short-term providers.
In terms of how much this could cost, Herndon says the study will determine that. But she did say they have their eye on some property that could serve as a site for roughly $8 million if they get that far.
That on the northwest part of Albuquerque, for example, there is an 8.1 acre vast array of land that has some infrastructure on it that would be perfect for carrying out a long-term facility. So that's just one area. I do not expect it to be anything that's overly burdensome for the state. It's just a matter of creating the coordination because counties have money, cities have money, the state has money, so we're going to put them all together and make them work together.
That bill cleared the House Health and Human Services Committee unanimously. Reporting from the Roundhouse, Natalie Wattis, KRQE News 13.
If that bill gets passed, the task force is expected to complete their study by December 1st. Representative Herndon is also sponsoring a bill this session asking for $16 million to create a long-term rehab facility.